Hello. So, just sort of how we did our lab lesson, we just want to give you guys an introduction into the clinical portion of the class. Once again, some rules and expectations, get you a little bit more comfortable on what we expect of you, what it will be like, things of that nature. So, one, what to expect. What is clinical going to be like? So, once again, we're going to be in a nursing home setting working with actual patients. You are going to be expected to treat them just like they are your own loved one. Um, treat them with respect, make sure you're being safe, giving them quality care. You will be assisting these patients with anything and everything that they need that would typically fall under the CNA job description. So that's going to be things like bed baths and showers, transferring them from maybe the bed to the wheelchair, any ADLs. So remember, that's activities of daily living, vital signs, helping them with meals, toileting, incontinence care, mouth care, dressing, undressing, anything that they need, we're there to help them with, okay? So that's why it's important we take that lab portion seriously so you're confident and comfortable to get ready with this. Now, you're going to be working with several different patients throughout your clinical experience. We don't give you just one single patient for the day to take care of. All right? Every single patient is different. How we help them is going to be based on their needs and abilities. So when you work with a variety of patients, it makes you a more well-rounded CNA. And when you leave clinical, you're going to feel more prepared to take care of several different types of patients, not just one patient. So does it make clinical a little bit harder because you're not working with the same patient the entire time? Answer to that, yes. But are you going to feel better at the end of clinical because you've worked with several different types of patients? Yes. All right. So, our whole goal is to get you as much experience as possible during your clinical time. So, part of that responsibility is also going to fall on you to make sure you put the effort in and always stay busy. Okay, we're going to go over rules shortly, which I'll cover this a little bit more. But we're going to provide you with an awesome place to go to clinical where you guys can get a lot of experience with different types of patients. But you're an adult, and part of that is your effort as well and how much you get in. You will be paired with another student, so we're not throwing you to the wolves and saying, hey, figure it out, you're on your own. We're going to put you with another student, so you'll be paired with somebody else. All right. Now, obviously, as an instructor, we cannot be with you throughout your entire clinical experience, holding your hand and helping you through every single step when caring for a patient. One reason why we also pair you with another student. But between the instructor and the staff at the nursing home, you will have support to help you through it. Before we send you in to do something, we walk through that skill or that activity that you're going to be doing with the patient with you to make sure we answer your questions, you're set up, you have the equipment you need. We sort of walk through it to give you that confidence you need. And then as an instructor, what we're doing is we're sort of popping in from room to room, spending a few minutes in each room, helping students, guiding them through it, making sure we're checking you off on these skills, and you're being safe. The staff is also amazing where we go, and they will be doing the same, helping you answer questions, giving you tips and tricks as well. Studying at home is going to be important while you're preparing for clinical, making sure that you're going back through the videos. Taking time after lab, if you need extra time or you feel more comfortable having more practice, stay after lab and practice. Most days, as instructors, we're available to stay after and help. If you feel like you need additional time, we can have you come back to another lab as well. So the more you practice, the better you're going to feel getting ready to go into clinical as well. So some of the rules of clinical. One, make sure you bring pen and paper to take notes. Now, you don't bring a huge notebook because you're going to end up losing it. Bring paper or scrap paper or a smaller notebook that you can throw in your pocket, and then a pen that you can just slide in your pocket as well. That way, when we're talking over how to do things or the type of patient you're going to be working with, what room number to go to, if you're doing vital signs, you can write them down. That way, you have little notes to sort of look at. If your hair is longer than shoulder length, it must be worn up in a ponytail or bun so it's off your shoulders. It's not hanging down on the patient when you're taking care of them. You must wear your purple scrubs to clinical. Once again, just like lab, you need to be on time and and there's no absences allowed. If anything's going on, make sure you communicate to us and we'll see what we can do to help you depending on the situation. But you must be on time and no absences allowed. Absolutely no cell phones are allowed at clinical. We are thankfully allowed in a great nursing home, and it's important that we follow their rules. If their employees have their cell phones out, they can be terminated or written up for that. So, same thing in regards to cell phones. There will be no warnings. If I see your cell phone out, you will be asked to leave clinical. So, please make sure that you either leave your cell phone in your car, or if you bring in a small bag or something, you can leave it where we can store that. Our number one priority while we're in clinical is safety. Do not do anything that you feel is unsafe. If you have a question about how to safely do something, make sure you ask the instructor that's there with you, okay? We have to make sure our patients are safe. And I'll cover this in another slide and go over some key safety points that we'll be looking for. Obviously, we want you to be professional and respectful at all times. So that means treating not only the patients and their family members, but also staff with respect at all times. If you have any issues that arise, a patient that's being disrespectful, a family member that's being disrespectful, a staff member, bring it to me and I will help you handle the situation in a professional and respectful manner, or whoever your instructor may be at the time. Obviously, quality care is extremely important. You should be caring for these patients, once again, just as if it was your own loved one. Make sure you follow directions and stay on task, all right? This is a huge one. One of our biggest pet peeves is when we see people just standing around in the hallways. At all our clinical locations, there are typically 100 plus patients in there. There is always something to do. We can always answer call lights. If somebody's out of bed, we can make their bed for them. We can practice vital signs. We can do hand and nail care. We can refill waters, just double checking to make sure they're not on fluid restrictions. But there are always things that we can do when there's not something that's been given to us, all right? So make sure you're staying busy. I don't want to see you standing around in the hallway and never sit down during clinical, all right? So please make sure you're always staying busy. Any questions or concerns, make sure you come to the clinical instructor. Staff members are busy doing their jobs, and although they're there to assist us, it can be a little overwhelming when we have the same questions being asked by students to the staff members. So if you can, please come to the clinical instructor with any questions or concerns. Once again, you make your clinical experience. Take full advantage of everything and anything that you can do while you are there, and make sure you are getting hands-on. If you're shadowing a CNA for a few, put on gloves and help the CNA. Just don't stand back and watch. Have confidence, all right? The patients are going to feel more comfortable when you come in being confident, okay? Make sure when you're taking care of patients, you sort of want to be careful on what you're saying and how you're doing it. If you had someone come up to you and say, oh yeah, this is the first time I've done this, I've never done this before, how would you feel as a patient? A little nervous, right? So go in with confidence. You don't need to lie to them and tell them that you've done it several times, but go in with confidence. And yep, absolutely, we know what we're doing. We're here to help you. If I come in and I'm watching you or assisting you, be careful of what you say in front of the patient. A lot of times I go in and students are, okay, well, how should I do this with the patient? Well, ask the patient. Most times they're able to communicate with you their needs and their wants and how they want things done. So if you have a patient that's able to communicate, make sure you ask them, because they're in control of their care. Don't just ask me, ask the patient. If they're not able to communicate, that's where it can be a little bit more difficult, and that's where the staff and myself will help you a little bit. But don't be afraid to ask the patient if they want things done a certain way. Obviously, typically we don't have any issues, but any unprofessional and inappropriate behavior will not be tolerated, and you will ask to leave clinical and unable to finish the class if this happens. So just make sure, once again, you're behaving in a very professional way while you are there. So I want to highlight some key safety points, because safety is our number one priority. I just want to make sure you have full understanding of some safety concepts. One, you are never going to transfer a patient without looking up their transfer status. Now, where do we typically find their transfer status? In their care plan. All right. Now, you may not have access to all of their care plans. So, what that means is you need to come to me as the instructor or whoever your instructor is, or you need to go to a staff member to get the transfer status. Sometimes patients can insist and sound very confident in their transfer status, and it may be a lie. I've had a patient sit there and tell me they're a one person assist, that they just need a little bit of help, and really they're a Hoyer lift. Well, what happens if I tried to get them up with a one person assist because I didn't look in their care plan, I believed what they told me, and they fall and get hurt? Whose fault is that? It's my fault because I never looked in the care plan to see what their transfer status is. So sometimes patients are confused. They feel like they can do better than what they really can. So we always have to follow safety protocols. So never transfer a patient based on what they tell you. Always check the care plan and clinical check with the instructor and the CNA. Always make sure your patients have non-skid footwear, their feet are flat on the ground, the wheels are locked on any devices you are transferring them to or from, and make sure that all devices are at transfer height. If the bed's really high and we're trying to transfer them into the bed, that is not safe. So always double check those things before transferring. If somebody needs assistance with transferring, they should always have a gait belt on, all right? Never take a shortcut with safety. So that gait belt needs to be on. It needs to be on correctly. When it comes to using a sit-to-stand or a Hoyer lift, you have to have a staff member at clinical with you, okay? It's just a safety rule because the lifts are all a little bit different. They can be very dangerous. So you cannot use a sit-to-stand or Hoyer lift without a staff member present with you. When you're transferring a patient, like I said, always use a gait belt, all right, and make sure it's applied correctly. When you're transferring a patient, all right, when you guys do this in lab, it's easy to transfer somebody that can already sit and stand on their own and can walk on their own. But when they need assistance, it's going to be harder than you think. You have to have a very good grip on the gait belt. You want to make sure that it's tight and you and the patient are ready for the transfer and you're communicating well with your patient. If you're ambulating a patient, which means walking again, maybe to the toilet, in the hallway, in the room, or anywhere else, I always want you to bring the wheelchair with you just in case they become weak, they get dizzy, or they need a break. So what that would look like is you have a hand on the gait belt and then the other hand on like the armrest of the wheelchair, so it's right behind you. That way, if you need it, you have it. If you have another student with you, you can have the other student pushing the wheelchair. That way, it's just there just in case, sort of just to be proactive when you're transferring a patient, especially when you're new, is going to be extremely important. When you're rolling patients, make sure you're always rolling them towards you. Make sure they're a safe distance from the edge of the bed as well. Your exit protocol, two major safety points are going to be that the bed is lowered at a safe level and they have their call light in their hand. If you are unsure of anything, make sure you ask. That's what clinical is there for, is it's still a learning experience. So we want to make sure you guys ask as many questions as you need to feel comfortable and confident. You're going to wish, once you start working, when things pop up, you're going to wish you asked them in clinical when you had somebody right there to answer these questions. So take advantage of this. All right, I want to go over mealtime real quick. So when it comes to mealtime, they're going to typically bring the trays out on a cart. Anytime you go to open the cart, when you're finished grabbing a tray, make sure you close the cart to help keep the meals a warm, safe temperature as we're passing trays. Before you go to pass the tray, you need to check the meal ticket. Make sure you're checking the name, the room number, the texture of the food, the fluid thickness, anything like that, and then you're checking what's on the actual plate. Don't just look at those things and be like, okay, we're great, and not even actually look on the plate to see if those match what should be on there. When delivering food, please make sure that you check that you have the correct patient, especially when there's two patients in one room. All right, it's happened before where they've mixed up trays. When people have allergies, different textures of food, that can be super dangerous. So double check that you have the correct patient. Some patients have very similar names. Same thing. Check that meal ticket. Make sure you're checking the patient's ID or confirming that that's the correct patient. Allergies are extremely important that you check. So make sure you're looking on the plate and tray is free of any allergies that are on the meal ticket. If the patient is sleeping, you must wake them up so they can eat their food at a safe temperature. If the patient chooses to go back to sleep, that is on them, but you must wake them up when you deliver the food so they know that it is there. You need to make sure that the patient is in a safe eating position. So they should be sitting upright as close to 90 degrees as possible. Even if they can feed themselves, we should make sure that we offer any assistance in cutting up the food, opening up any sauce packets, creamer, sugars, and setting up the tray so it's easy for them to have their meal. So once again, just because they don't need help with feeding doesn't mean they're not going to need help with cutting up food and opening those things. So make sure you have everything set up and ready for them. You want to make sure that all items are within reach. So say, for example, maybe it's a stroke patient and their left side is affected or weak. Make sure all the items that they need are within reach of their unaffected or right side in that example that I just gave. These all seem like common sense, but clearly I have them here because they're mistakes I see every single clinical. So always double check all of these things when it gets to mealtime, snack time. Isolation rooms. So this is going to be really important because especially now during the COVID-19 pandemic, and we're not sure obviously how long this is going to last, but even when we're not in the COVID-19 pandemic, there are going to be times where there are going to be rooms that are on isolation or precautions. You should typically see either a little flyer on the door that says stop, precautions, isolation. There may be a door hanger, but it's your job to check the door before you enter to make sure they're not on isolation. So what I suggest is, and what I will do is add the how to properly put on and take off PPE equipment video to this lesson as well, but review it in the indirect care lesson as well, because especially right now during COVID-19 pandemic, but like I said, no matter what time this is, once we eventually get out of this pandemic, you're still going to need to know how to properly put them on and take them off. Make sure you review the different types of isolation rooms: contact, airborne, droplet. Like I said, PPE equipment will typically be on the outside of the door or in a cart in the hallway. If it's not outside the door, make sure you follow exactly what you need to put on PPE. PPE should always be put on prior to entering the room when somebody is on isolation or precaution. So you do not put it on once you've entered the room. You put it on in the hallway, following the correct standards on how to put on PPE. You should always remove PPE inside the room at the door and properly dispose of it in the containers that are for the PPE equipment. You would wash your hands and then exit the room. You should never have gloves on or any PPE equipment on when you're leaving the room. That means you do not properly exit the room. Right now, during the COVID-19 pandemic, and we're not sure how long this is going to last, so we'll help let you know as you enter clinical too what needs to be happening. But masks must be worn at all times during the clinical setting. There are no exceptions to that. You have to wear an N95 mask. We will supply it as long as you have to wear N95s. They'll be supplied. At some point, if they move it to where you just have to wear a surgical mask or some type of other type of mask, you'll be responsible for providing those. But right now, you are required to wear N95s. And we'll do our best to update this as it changes. Things change constantly. So, but we'll do our best to update here. But like I said, we will supply any further masks beyond the normal masks that you have to wear, like to lab and out in public right now. Once again, I cannot stress this enough because it happens every single clinical. You cannot wear gloves in the hallway or in the dining room. I can't tell you how many times I see students exiting rooms with gloves on. That means you did not take off your gloves and wash your hands, and now you're bringing bodily fluids and bacteria from that room out into the hallway, which can spread infection. So make sure you're following your entry and exit protocol, how to properly put on and take off PPE in the correct spots as well. So I just want to now go over what some of these things are going to look like in clinical. So the first thing I'm going to cover here is a clean utility room. In the next slide, I'll show you a picture of the clean utility room just to give you a visual of what it looks like. So what a clean utility room is going to include are all the clean linen and clean supplies. Now, typically in most patient rooms, you're going to find things like basins, briefs, wipes, soaps, and lotions are typically already going to be in the patient room. However, all the clean linen and additional supplies past that, you are going to have to get before you enter the room to help a patient. So these are all going to be found in the clean utility room in the facility. There will not be any linen stored in the room, so you must get all of your linen once again prior to entering the room. So if you know you're going to be doing a bed bath, you should go to the clean utility room to get the equipment that you need, such as your sheets, towels, washcloths, bath blankets, gowns, bed pads, anything that you need, you get there, all right? And then you take it into the room. I always suggest checking the room before grabbing any additional supplies like basins, bedpans, wipes, briefs, hand and nail care, mouth care, shaving, because a lot of times they may have that in the room already, and we don't want to waste equipment. So always double check before you grab supplies. That way we're not wasting equipment. Typically, you're going to find wipes, soaps, lotions, things, mouth care, shaving, hand and nail care in the top drawer of their nightstand, or maybe even in the top drawer of their dresser. If they have a private room, sometimes it's in the bathroom as well. Basins a lot of times are found in the nightstand or the bathroom, sometimes sitting on top of the dresser. So sort of look around so we're not wasting that equipment. Really important here. Once an item leaves the clean utility room, they are now considered dirty. You should never re-enter or try to put back something in the clean utility room once you've brought it out. So once you've brought it out, is now dirty. If you don't use it, it should be thrown away and or put in the hamper or disposed of depending on your facility's policies, okay? Make sure when you are carrying linen, you are always carrying it away from your scrubs. Remember, proper indirect care is going to be important. So always carry linen away from your scrubs. In this, you'll see a picture of an example of a clean utility room. This is how some look, a majority of them, but just to give you an idea, you'll see that you have all your linen to the side, you have basins, bedpans, soaps, wipes, briefs, stuff for hand and nail care. You have everything you need in there. So that's where you'd walk in, grab what you need, and exit. Once again, you cannot go back in. Once you bring something out, it is now considered dirty. But just wanted to give you a visual of what to expect on what the clean linen room or a clean utility room looks like. Now we have the soiled utility room. So with the soiled utility room, things are going to be a little bit different than the classroom. For example, in the classroom, we had all our supplies next to the bed, right? So when you were in the lab, you had your shelf right next to you with all your linen and supplies on it. You just learned that's not going to be the case in clinical. You're going to have to go get most of your supplies from the clean utility room, then enter the room. Things are also a little bit different when it comes to the soiled utility room. There is not going to be a hamper in the room at the nursing home setting. What we will do is we will give you guys some garbage bags or get some from the facility, and you will keep them in your pocket. Your hamper is a garbage bag that you're going to put all your soiled linen in, and then you remove it and go put it in the soiled utility room in the proper bin when you are finished. Same thing with trash, especially if you're changing a brief. When you're done changing the brief, it will be put into the dirty brief will be put into the trash, and you'll bring that trash bag out with you when you leave the room. We don't leave that in the room. We don't want it to cause a foul smell in the room. So always empty that, and that will go to the soiled utility room in the proper bin. There's typically 2 bins. I'll show you a picture of the soiled utility room next. So typically there are going to be 2 large bins in the soiled utility room, one for trash, one for linen. Make sure you're putting trash in the trash bin, linen in the linen bin. Personal clothing should go in a mesh laundry bag. So each patient at most places should have a mesh laundry bag with their room number on it. All of their personal clothing, what they're wearing, if they have a personal blanket that they've brought in, should go in that mesh laundry bag. If it doesn't go in there, the laundry team does not know who it belongs to, and it tends to get lost. So make sure you put all their personal linen, their personal clothing, in the mesh laundry bag, and then that can be taken to the soiled utility room and put with the rest of the linen. but it has to be in that bag in order for them to know that who it goes back to. So all linen, bedding, washcloths, towels, bath blankets should be placed in a trash bag and taken to the soiled utility room. You can typically find trash bags in the drawer of the soiled utility room if you run out. All trash bags should be emptied before you leave for the day and taken to the soiled utility room and placed in a trash bin. And once again, whenever you're changing a brief or Depends, you never leave that brief or Depends in the trash can. Always remove that trash bag and take to the soiled utility room. Obviously, replace the trash bag. So there's an empty trash bag in the trash can when you leave as well. Here is a picture of what the soiled utility room looks like. Pretty simple. There's 2 bins, one for trash, one for linen. As you can see to the right, there's a sink in there for you to wash your hands if you need to. Also, there is a few drawers that typically have trash bags in there. This is an example of what a soiled utility room looks like for you. I wanted to give you an example and go over showers with you guys. A lot of students always struggle a little bit with showers. It's a little concerning. Obviously, there's a lot of safety issues when it comes to showers because we're in an area where there's tile and now it's all wet. So we want to make sure we're being careful with the patient. So how we set up a shower for a patient is we're going to need quite a few additional towels. What we're going to do is we're going to put one towel on the bench of the shower. And I'll show you a picture of what the shower looks like on the next slide. So one towel should go on the bench. One towel should go on the floor of the shower, but make sure you don't cover the drain. And then one towel on the outside of the shower on the floor. The reason we put the 2 on the floor is obviously when tile gets wet, it becomes extra slippery. That towel allows for a little bit of grip for the patient. The reason we put it over the bench can become a little slippery as well. And the patient just feels a little bit more comfortable typically with that extra towel there. You want to make sure washcloths are within reach. I typically hang them on the side of the grab bars, just off to the side so they're not in the way of where the patients need to grab. When I say grab bars, you'll see what I mean in the next slide when you see a picture of it. But they're the metal like handicap bars that you typically see in bathrooms and showers that people can use to grab to help stand up. When you're transferring a patient into the shower, you want to make sure you use those handicap grab bars and have the patient assist you when they're getting in the shower. So the patient will be dressed when they're getting into a shower because you always have to have clothing or a gown under the gate belt. So we can't undress them because we can't put the gate belt on bare skin. So they're going to be dressed when we slide them in. We're just not going to have the shower on yet. So we're going to have them dressed. Use those handicap bars to help the patient stand up. Use the gate belt to transfer them. And then once they're sitting on the bench in the shower, you can have them use the handicap grab bars in front of them to stand up and use the gate belt to assist them to help pull down the pants and the brief or underwear. Sit them back down. You can then finish taking off the pants. You can remove the gate belt and take off their top as well. During the shower, you should not leave the resident alone unless you've been told that they are okay in the shower alone. Obviously, once again, even for those people that are independent, we need to be careful because it's easy to slip and fall in the shower. So if it's my first time showering an independent person, I always sort of stay, on the other side of the bathroom door to let them know I'm there. That way, they need assistance. I'm just making sure they're safe. If you're told by a supervisor or the instructor it's okay for them to be there and they're alone, then obviously that's all right. For those that need assistance, you will stay with them at all times, assist them with washing their hair and their entire body, rinse and dry. What I always tell students, is think about how you would take care of yourself or shower yourself in the shower. That's exactly how you'll take care of the patients in the shower, okay? And that's sort of a good rule of thumb when you're helping a patient with everything in clinical is how would you do this to yourself? That's how you should do it to the patient. Really no difference, okay? Transferring out of the shower, what you're going to do is you're going to fully dry the patient while they're sitting on the bench in the shower. Then what I do is I dress the top of the patient. So if they want a bra on, if it's a female, if they're just going to put their top on, you're going to put their shirt on. Then you're going to apply the gate belt. And then what I do is I remove that the wet towel a little out of the way, place the pants around the ankles and the brief, and then I'll assist them with the gait belt to stand up. Once again, have them use those handicap bars, and then I will slide the pants on, along with obviously the brief or underwear, do up their pants, have them sit back down, make sure that bench is dry. Sometimes I'll bring an extra towel to throw on and remove that wet one if needed. And then you can transfer them out of the shower. But you want to make sure you get them dressed in there so you can apply that gait belt and safely transfer them. Here's a picture of the shower just so you can see what it looks like. They have the bench. They have those metal handicap grab bars all along the shower as well. As you can see too, what you can do is the shower head is removable, so you can pull it off and move it around. Makes it easier to help rinse, wash the patient as well. So here is a example of a patient's room for you. What this looks like is you can see that they have a dresser, they have a nightstand, and they have a closet. They have a bed in there. There's typically a TV in their overbed table, as well as a bathroom. Their call light is attached to the wall above the headboard. You'll see that they should have a TV remote and a phone typically in the bedroom or their patient room as well. I just wanted to give you a good look of what it looks like. Typically in the closet, you'll find their clothes. A lot of times the mesh laundry bags in there, and their briefs are usually in their closet as well. The top drawer of the nightstand, once again, a lot of times soaps, wipes are found in there. Basins sometimes on top of the dresser or in the bathroom as well. So just wanted to give you a picture of what that looks like. All right, I just want to go over where to park. So when you are going to Regency at Bluffs Park, you're going to park at the bottom of the hill in the small parking lot at the very bottom of the hill, which is closest to the main road. If there is no parking in that very first lot on the left when you pull onto Huron View Boulevard, you're going to park on the street on the bottom half of the hill that's on the same side of the facility. All right, once again, you have to park on the same side of the facility at the bottom half of the hill. Do not park behind the facility. Do not park on the street on the opposite side of the facility or in any other parking lots, as you may be towed. All right, once you park at the bottom of the hill, you will walk up the hill and wait outside of the front door for the instructor. Please do not go in the facility. There's a little covered area outside. Wait at the front door for the instructor to come and bring everybody in at once. I would highly suggest arriving early. One, you park at the bottom of the hill. It's going to take you a few minutes to get up the hill into the facility. Secondly, you've never been there before. It can be easy to get lost, hit traffic. So make sure you get there early and to give yourself a little additional time to get up the hill. I just want to review the requirements to enter clinical one more time. So as a reminder, all online work must be complete minus the state exam lesson by 5 p.m. the day prior to your clinical. You must have an average of 75% or higher in the class to be eligible to enter clinical and continue in the class. You must have completed all 3 lab days and passed lab. You must also have a negative TB test within the last year uploaded to the student portal. Once again, to upload that, you have to go to the student portal, click on My Uploads. On the left-hand side, it will say enrollment documents. Click that and upload your TB test. It has to be a negative TB test within the last year. You cannot enter clinical without that TB test in your portal. Lastly, if COVID testing is still required, which it would have been mentioned in your welcome letter or initial emails that you received from us when you registered, it is important that you have gotten a COVID test. We will be testing you, and we will be communicating with you on the day and times you will need to be tested. So it's just extremely important that you look at the emails, you read them, and you understand when you're supposed to be getting your COVID test from us. If you have any questions, as always, make sure you just shoot us an email or give us a call. That sums up the clinical lesson, expectations, rules, and tips and tricks for you. So, as a reminder, your clinical will be at Regency at Bluffs Park, which is located at 355 Huron View Boulevard, and that is in Ann Arbor. It is just a few miles away from U of M campus if you're trying to get an idea of what it looks like. We are super excited to have you in clinical. The residents and patients at the nursing home absolutely love having you guys. Come with a smile, come excited, and have some confidence in yourself. You guys are going to do great. We'll see you soon at clinical.